Now, imagine the two sticks here being the legs, and then we have the pelvis that sits on top of it. When our pelvis tips forward, called anterior pelvic tilt, the hips are relatively rotated in. That's because of the alteration in the position of the hip socket. Now, if we move in the frontal plane toward the right, we can see that we are adducting this hip, which is further increasing internal rotation in the right hip. Now, lastly, if the pelvis rotates on top of or toward the right, on top of that right leg, now we have basically maxed out internal rotation. And that way, oftentimes people are complaining about this kind of hip pinching kind of scenario going on the right. So the corrective method here is to rotate the pelvis to the left, adduct the left, and posteriorly tilt the pelvis to reverse what we found on the right side and see if that gives relief of the symptoms on the right side,